Hi, my name is Monique Helton. I am a nursing student here at Nightingale College. I am here to present to you today Kyle Reeves, a 16-year-old Latino male patient with the chief complaint of increased cough with a fever reaching the maximum of 101.7 degrees Fahrenheit. His vitals are as follows: temperature 101.9 degrees Fahrenheit, taken orally, heart rate of 90 beats per minute radially, respiration 30 breaths per minute with a slight work of breathing, blood pressure 118/78, taken via the right arm in the supine position, oxygen saturation at 89%, via air um, taken by the finger probe. The patient has the present illness, which is the increased cough with fever. Patient describes the discomfort with breathing. He denies any pain. The patient is receiving antibiotics and acetaminophen, has a past medical history of cystic fibrosis. Patient denies prior surgery. Current medication that the patient is taking is Tylenol, as mentioned previously, and he is taking that for pain and fever. Patient has not been taking the medication prescribed for cystic fibrosis, and education has been provided. Patient is also taking 2 liters of oxygen via nasal cannula. Psychosocial data. The patient lives with his mother, and she is the primary caregiver, and they have an excellent relationship as she is his main person for support. Patient's family history of disease is unknown. The first system review was the respiratory status, as a chief complaint is increased cough with the fever. Patient states he is having difficulty breathing and has visible green colored sputum. Patient has no problems communicating except when he is having trouble breathing. Subjective data, patient states, I seem to be having a little trouble breathing, so I did reposition the patient and administered oxygen 2 liters via nasal cannula. Objective data, patient limbs are symmetrical and even, smooth and steady gait. His spine is midline and scapulars are even and in line with each other. Upon auscultating the lungs, I did hear auditory wheezing. The TMJ, head, neck, wrists, elbows, fingers, hips, knees, feet, and spine all have range of motion with no pain, no warmth, and no crispness upon palpation. Internal and external rotation performed. The muscle strength were normal to the left and right deltoid, the biceps, triceps, wrist, fingers, hip, hamstring, quadriceps, and ankles, all being 5 out of 5. The patient is on a high calorie, high protein diet and has no allergies. The patient is alert and orient times 4 with a pleasant attitude. Review of systems. Patient is independent with ADLs as far as bathing, eating, and is continent of bowel and bladder. Thank you for your time.